infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the World Economic Forum believes pandemics could cause $570 billion of annual loss to the global economy. Now, recently, the leader in epidemic risk modeling, Metabiota, released a free tool for tracking events that could impact human and economic health. It's called the Metabiota Epidemic Tracker, a free, new platform to view, analyze, and understand events that could impact people, industries, and nations. Well, joining me now is the head of product at Metabiota, Ben Oppenheim, PhD. Dr. Oppenheim, welcome to the show, sir.
Thank you very much. It's a pleasure to be with you.
So, what is the Metabiota Epidemic Tracker, and how does it work?
The Epidemic Tracker is a free online tool. Anyone listening can access it at epidemictracker.com. And it is a visual representation of outbreaks occurring all around the world with an easy interface to try and access up-to-date data on the severity of those events, on the numbers of people affected.
And who's it directed at? Who's your target audience with that?
We've tried to build this tool to really be accessible to anyone that has an interest in global health and in outbreaks. So it might be a corporate risk manager or someone responsible for teams of people who are traveling or working abroad. Might be an ordinary traveler, someone thinking about or planning for a trip that might take them to a place that could have active outbreaks. And it's designed really to try and take the complexity of epidemiologic data and make it as simple as we can. So it's a map layer and with icons to indicate where countries have current outbreaks of concern, and then an easy way to access estimates based on a number of different reporting sources of cases and deaths to get that quantitative sense of severity of the outbreak.
Sure. And how frequently is it updated? Is it updated in real time or something close to that?
Yeah, it's updated on a regular cadence. We have a large team of data analysts and scientists, epidemiologists who are tracking outbreaks around the world. As I mentioned, in a number of different reporting sources, identifying the most appropriate source for most accurate, up-to-date source for each event, and then structuring that data. So as that structuring occurs, the data are updated by that team. So the map layer, as I mentioned, contains icons to indicate where we have new data available. So folks interested in a particular outbreak can kind of readily see if there's some new information that we've structured to report.
So does it track all outbreaks? Because there's a lot of outbreaks out there, or just some high priority type outbreaks?
Yeah, it's a good question. It's a big universe of outbreaks unfolding around the world, and here, and in general, we direct our attention to outbreaks of potentially significant health and economic concerns. So trying to zoom in on outbreaks that and pathogens that either have the potential to really impact human health on a significant scale, or have attributes that might make them economically or socially disruptive. For example, pathogens with really severe symptoms that might drive public anxiety. So we cast a very wide net, but there is a prioritization algorithm underlying our selection of outbreaks for monitoring that takes into account a number of factors to really get us to focus on those events that are of most significance globally.
Now, I noticed on there's a biweekly report that you provide. It's called the Current Global Outbreaks of Concern. What information is in that?
That's a report that we've been producing for some years now for the organizations we work with. We wanted to open it up here to members of the public who might be interested. And it contains some of the same information you see in the tracker. So there's a map which indicates which pathogens we're monitoring around the world, where those outbreaks are, their severity. But then there's also a kind of qualitative narrative analysis that gets readers into a more detailed view of the dynamics of each outbreak. So, for example, in the current release, there's some detailed coverage of a really severe outbreak of Ebola virus in Kivu in DRC. But then also coverage of a hepatitis outbreak in the United States. So it covers a number of different It's global in scope, covers a number of different pathogens, but again, tries to zoom in on those events that we think are of greatest significance.
Now, if somebody wants to find it, is it only found at the Metabiota website, or are there apps for your phone or iPad or whatever?
It is mobile optimized, so anyone who wants to access it on the go on their phone can go to Epidemic Tracker, and everything gets all the complexity of that map layer gets distilled down and is readily navigable on the phone.
Excellent. And just finally, I want to give you a chance to explain to the audience what is Metabiota and what do you guys do?
Yeah, no, thank you for offering that. So we're a risk analytic firm. We focus all of our energies on epidemiologic threats in global health. So our company's roots are in virology and field epidemiology. We had folks around the world looking for new viruses that could cause, the next epidemic or pandemic. Doing a lot of capacity building and training, building labs, training people along the way. And over time, we've developed a wider range of skills and competencies. So we do a lot of computational epidemiology, as well as data-centric work, tracking outbreaks around the world. So our goal is to help people understand, historically what outbreaks have happened in contemporary terms, what outbreaks are unfolding around the world. And then using those computational tools, we also look at the really critical hypotheticals. What could happen? What outbreaks are possible? What does the future of risk look like? And use that information in a number of ways to help inform governments and international organizations that are working on mitigating those events, and then to work with the private sector to develop financial tools to understand the potential impacts of outbreaks and try to mitigate them. All of that with the goal of trying, to make our own contribution to safeguard human and economic health.
Interesting stuff. And for people that are interested in the Epidemic Tracker, I will link to it on the podcast when I get it published. And I want to thank you, Dr. Ben Oppenheim, for spending this time with me explaining this new tool.
Thank you very much for having me, and I hope folks sign on and enjoy the tool.
Thank you, sir.